Your doctor has recommended a shoulder capsular shift repair, also known as shoulder capsule stabilizing surgery. The shoulder joint capsule is a sac of connective tissue that encloses the ends of the arm and shoulder blade bones. This capsule can become stretched or displaced when the arm bone dislocates, leading to joint instability. This keyhole operation involves making small cuts around the joint to insert a camera and instruments. The surgeon usually makes a larger incision on the front of the shoulder. The joint is filled with a saltwater fluid to expand it and create room for the surgeon to operate. A cut is made in the joint capsule. The portion of the capsule that was loose is then reattached to a position higher up and fastened with sutures. This results in the capsule being tighter. The fluid is drained at the end of the procedure. The cuts are then closed with sutures. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.